Well, hello everyone. I'm pleased to welcome you all to this important webinar. I'm Anthea Hancox, the CEO of the Scanlon Foundation Research Institute. Firstly, may I take this time to acknowledge the traditional owners of the lands on which we're meeting. For me, it's the lands of the Wurundjeri people of the Kulin Nation, and I encourage you all to use the chat function to also acknowledge the traditional lands that you are attending from. I would also, in the spirit of reconciliation, like to pay my respects to Indigenous elders of the past, present, and those taking us into the future. I welcome those who are with us today. Today's webinar will feature 4 exceptional individuals who will share their experiences with us: Trish Prentice, Om Dongal, Wei Tai, and Licia Heath. The focus of this session is unanticipated consequences. Many of us experienced the frustration during certainly the first year of the pandemic as governments sought to find a way to respond adequately to the multiplicity of issues. But what they seemed to miss was the knowledge, trust, competency, and comprehensive networks that existed at the community level. An appreciation of the strengths of these connections and relationships could have had a dramatic impact on the actions required to support the public health response. Knowing this now, though, we have a responsibility to ensure that these strengths are an integral part of how our society operates, that they are valued, resourced, and deployed in a way that demonstrates our recognition that diversity is an essential and vital part of a highly functioning society. In this webinar, we have asked our speakers to present their thoughts for about 10 minutes on each of this topic. If you have any questions, please share them in the chat, and then we will try and answer as many as possible at the end of the presentations. If they are directed to any one speaker, please note that at the beginning of the question. As you probably already have noticed, this session is being recorded. The webinar will be available on the Scanlon Foundation Research Institute YouTube channel in the coming week. Now, I would like to introduce our first speaker, Trish Prentice. Trish is the senior researcher at the Scanlon Foundation Research Institute. She will explore the themes that she discovered as a result of undertaking the qualitative data research for the 2021 Mapping Social Cohesion research report. Thank you, Trish.
Thank you. Just bear with me as I share my screen with you. Good afternoon, everyone. So I'd like to share with you today a piece of research that we conducted in addition to our Mapping Social Cohesion survey in 2021. And we were very aware that the survey would give us particular insights into what was happening in the pandemic, but we wanted to make sure that we had a deep understanding of what was going on in communities. And in a sense, we wanted to make sure that we were asking the right questions. So what we did was we conducted interviews in 10 local government areas around Australia. So these were national interviews covering all of the mainland Australian states. And the areas that we chose to carry out these interviews were areas of high cultural diversity. And the people that we chose to interview were those we considered to be key community representatives. So people like health workers, teachers, parents, small business owners, local government representatives, and people working in the social services sector. And we felt that these were the people who had deep knowledge of their communities and the networks that we needed to understand what was really happening at the coalface at the time. Now you can read the full report as part of our Mapping Social Cohesion report this year. But what I'd like to do is just to share with you 2 reflections from that piece of research. The first is that not everyone entered the pandemic at the same starting point. Some people were better equipped and better resourced to meet the challenges that arose during the time. Now, this is quite a well-known diagram. It's usually used to demonstrate the difference between equality and equity. But what I think it illustrates for us is that when we make the assumption that people are all at the same starting point, some people are actually faring worse because of that assumption. And the research showed this in 2 really clear ways. The first is that many people had unequal access to technological resources. They had unequal knowledge of how to use technology, and they had unequal levels of access to data. And because of this, they had different levels of capability when we were all required to jump into this online world that we were required to navigate. I'd love to share a story of a mum who was attempting homeschooling, as many of us were. She sat her children around the kitchen table. She had 3 children, and between them, they only had one iPhone. And so what she would do was she'd take it in turns with her children to log on online and to do the Zoom meeting and to post work. And she'd do this one at a time each day with her children. And she created this beautiful narrative for them that they were doing village schooling, just like she'd done as a girl in her home country. But the reality was that she was really struggling to meet the requirements of what she was required to do for schooling her children during that time. There was another story that was shared with me of a man in Port Adelaide. And this is a really interesting story because Port Adelaide was an area that did not experience significant lockdowns. And what he would do is use quite a bit of his family income each day to buy data to keep his family online. And what he'd do each evening then was go out to the community centre and pick up a community meal and some groceries from the church and come home and feed his family, because he had to make this choice between keeping his family online and providing them with food. The other way this inequality of starting point was really evident was in terms of access to information. So for those with low levels of English proficiency, those with low levels of literacy, both in English or in their own first language, they really struggled to navigate the amount of information that we were all required to process quite quickly during the pandemic. And there are a couple of implications of this. And one of the biggest one was that those people were quite vulnerable to counter narratives. So for example, information that was coming from home countries, information that was coming from the internet, from social media, information even coming from well-meaning family or friends in the community. It's very difficult to get a balanced view or a balanced position on an issue if you only have access to a limited amount of information. And these people really struggled to navigate that as well as some others did. It also meant that their access to services online were limited because services online are typically in written form, and they found it quite difficult to access those services as a result. The second reflection I'd like to make is that it was quite evident that cultural communities could mobilise themselves, and in fact did mobilise themselves to meet their own needs. Now this is really important because often cultural communities are seen as passive. They're seen as recipients of welfare or services or help. But what the research we conducted showed was that actually wasn't the case. That community leaders, community organisations and individuals in communities really stepped up and took the initiative to meet the needs that were emerging in their communities. One of the most obvious ways they did this was with translation. And many of us are aware that government translations were slow and not always accurate. So individuals were out there in the community translating information and sending it out in community networks. They were using their own time and resources to do that. There was a great issue of food insecurity in many parts of Australia during the pandemic, and community organisations and faith organisations really stepped up to provide food to those who didn't have it. And there were also, there's great evidence of mobilisation even just at a neighbourhood level, where people were stepping up to meet their neighbours' needs and to check on them and to make sure everyone was okay. There was another lovely story that was shared with me of a Somali man who lived in an apartment block. And next to him, he had an elderly Italian neighbour, and he knew a bit of Italian, so he was able to talk to him and to help him get groceries and take him to the doctors. And on the other side, he had a Korean neighbour who had a little dog. And between this Somali man and the Korean neighbour, they had not a word of common language. However, the Korean man could say dog food. And so the Somali man knew that when he came and said dog food, that he'd need something for his dog, and he'd go out and provide it. And he had this sense that this man was going to be okay living on his own as long as his dog was well looked after and well fed. So what do we do with these reflections? I think there are two things we need to go. need to do going forwards. Firstly, we need to make sure that the right boxes are in place. We need to understand what our community needs are, and we need to add those boxes under people who need them. The second is that we need to listen to and we need to equip those who are in the best place to meet community needs. The final story I'll share with you is of an Afghani imam in Victoria. And in the early days, he lined up to get his vaccination for 3 hours. And once he got to the end of the line, he asked the nurse to take a photo. He said, I want to share this with my community and encourage them to get the vaccination as well. And of course, as we know, there's a no photo policy at vaccination hubs. And so he wasn't able to have his photo taken. And then he went back home and he ended up posting a nondescript photo on the internet of a needle and saying, hey guys, get the jab. What we need to do is we need to listen to those who are best placed to meet community needs. We need to draw on that knowledge and that capacity that's already there and to support it in the best way that we can. In the words of one of the interviewees, she said to me, we shouldn't be standing on that platform. We're not the best place to be there. We need to equip and resource those who are in fact in that place to do it. And I think that's one of the most important points to recognise going forward. Thank you.
Thank you very much, Trish. That was for those very important insights and for adding in so many fabulous stories of the people that you interviewed. I think many of the things that you talked to certainly will resonate with many of the viewers today. Our next speaker is Om Dungal. He's a most important community advocate, trainer and mentor, and I suspect that that actually understates exactly the contribution that he makes, but he was also featured in one of our most recent narratives on Blacktown, where he is committed to the people and bringing that community together. So Om, welcome, and we look forward to hearing your experiences at this time.
Thank you, Anthea, and for the warm introduction. My 94-year-old father passed away during the peak of the pandemic last September. There was total lockdown in place and funeral services were restricted to just 10 people. We could never imagine that there were just 10 of us, close family members, for his funeral. A man known in the community and across communities by his trademark hello and a smile. Even my daughter and son-in-law, and for that matter, my brother-in-law, who was very much a son to my father, couldn't attend. They just had to wait outside. We've heard of similar other stories, as much worse situations where close relatives or family members couldn't be together with their loved ones in their dying days. Personally, having gone through many crisis situations in the past, including having to flee my home country, Bhutan, to save my life, I've realized we have two choices that we have following such crisis. Do we come out wounded and continue to complain and suffer mentally? Or do we take the learnings and come out wiser and work towards creating a future that we all want? In other words, do we want to be part of the problem or be part of the solution? Before I continue, I would like to acknowledge the Darug people, the traditional custodians of fair water in Blacktown in Western Sydney, from where I'm dialing today, and pay our respects to the elders, past, present, and emerging. I'd also like to acknowledge my fellow panel members, Bue, Licia, Tris, and Anthea. I really commend your leadership, Anthea, and the transformational work that Scanlon Foundation does, which you mentioned the most recent Blacktown narrative being one such fantastic example. So thank you. Let me now briefly talk about my own involvement in responding to the pandemic and share some learnings. Blacktown. Blacktown shines, but did anyone notice? Blacktown became the highest vaccinated local government area in the country during the peak of the vaccination drive, having now achieved 95+% vaccination, double dose vaccination rates. For those of you who may not be aware, Blacktown is the largest council in New South Wales with a population of over 400,000 people. And we have people from 188 different birthplaces, and we speak 182 different languages. So how did we manage to be that highest vaccinated LGA in the country at that point in time? Well, firstly, it was a collaborative effort. The government, the service providers, and most importantly, which I think Trish touched upon, the active community champions and community leaders complementing our work with each other. Secondly, it was about identifying the issue and addressing it head on, rather than waiting for someone else to do it for us. For such a diverse community, as I think Trish highlighted earlier, reaching the right messaging deep into each of the diverse communities was a major challenge. Now, facilitated by Sydwest Multicultural Services, we rebranded our Western Sydney Leadership Forum into Emergency Task Force, and it started what we call a virtual door knock campaign. The virtual door knock was about calling 10 people in your network, asking about their well-being, and stressing 3 key messages. Follow the lockdown rules. It's about your household, not your family. Secondly, get vaccinated. And thirdly, get tested if any symptoms. And those 10 people were in turn asked to call 10 other people and do the same thing. And the pyramid scheme continued. So through this approach, we were able to reach deep into each communities in languages they understood and through people they knew and they trusted. So it was fantastic, like how we reached deep into each communities. Another example was about the Bhutanese community in Blacktown here, where seniors used to meet regularly at Sydwest. And when pandemic happened, seniors started panicking, people in the 80s and 90s. What do we do now? Can't go to Sydwest. So we said, okay, let's start a virtual, video conference. Almost 2 years now, it's become so popular now that more people, people from outside of Blacktown are able to join. People are not feeling too well are able to join from the comfort of their bedrooms. So it's become so popular, and the digital literacy has gone up. With even my mom at 90 years old started to learn Facebook and Messenger, so they're able to dial into the virtual, video conference by themselves. They don't have to wait for their son or daughters to dial in. So this has really enhanced the digital literacy in that age group. These are just a few examples that I'm aware of, and many others, such as Al Muntada in Iraqi community in Fairfield, Liverpool area, or the Assyrian community or the Syrian community, the South Sudanese community across Sydney. Every community is working so hard, and they have stepped forward and done so much for the community during these difficult times. So what did we learn from this? Firstly, I think it's no-brainer to say that we need a collaborative approach with bringing different kinds of expertise to work together. What do I mean by this? Currently, it's a top-down approach with the assumption that the content experts who know the subject, who are professionals, who are officials in the government, have all the answers. But in a community setting, the role of context experts that I think Trish refers to, people who are experts, who have that lived experience, who know the environment, local community, they are the context experts. So unless we bring in the context experts together with the content experts, we cannot have long-term solutions. We'll continue to have patchwork solutions, and we will not have any transformational change that we need today. Secondly, solutions come from within communities. We have always taken this top-down approach of, getting solutions across, and trying to implement the same size fits all kind of solutions. I think, as we have seen during the pandemic, I think solutions come from within communities. So rather than looking for problems, let's look for what's working well in each community and help nurture that and help address problems along the way. I'll perhaps leave it there for now and look forward to sharing my thoughts around opportunities to contribute towards the well-being of all Australians and beyond. Thank you, Anthea.
Not at all. Thank you very much, for sharing those thoughts and ideas about talking about the type of future that we would like to have. In particular, the focus on coordinated efforts, such as the virtual door knocks. And I love that reference to context plus content. It's a great way to talk about what we're looking for. So thank you very much for that. Our third guest is Boy Tai, who many of you will know as the Deputy Chairperson of the Victorian Multicultural Commission, but also has been recently named as the 2022 Citizen of the Year at the Whitehorse City Council Civic Awards. So congratulations there too. The VMC has been absolutely essential in bringing the latest health advice and resources to community organisations to maximise their vital role during the pandemic. We look forward to hearing from you, Boy.
Thank you, Anthea, and also the staff from the Scanlan Foundation. Thank you for the amazing work you do, and I'm absolutely delighted to represent the Victorian Multicultural Commission at this webinar. I also want to thank those who are tuning in and joining us virtually. Before I begin, I'd also like to start off by acknowledging the traditional custodians upon the land which I'm joining this conversation from. I pay my respect to the elders past and present. I've just been told to share my screen, so if you could please bear with me, I'll try to do that. My sincere apologies. Unfortunately, I don't think I can share my screen. So what I'll do is I'll just present, and perhaps at the back end, if we can share the points, that would be great. If not, I'll just proceed like this. I apologize for it. The Victorian Multicultural Commission has been working very closely with our multicultural communities, and it has been such an honor to work alongside so many community champions and so passionate community leaders. I just want to share, I guess, some of the points around what. Well, thank you very much. What were the unanticipated consequences of the pandemic, and then also share briefly on about some of the structural change that could benefit us, and also what we hope for in the future, so that our community's needs can be better met, and then I'll look forward to the Q&A to answer any questions. Firstly, I want to start off as the two speakers in front of me have mentioned, the care between the communities, the opportunity to witness that. It was just beautiful to see different cultures, faith groups come together quickly and willingly to share resource information, work shoulder to shoulder. An example that comes to mind is the Indian and the Vietnamese community members working together, distributing food for the high-rise estate. This is I was very privileged to be on the ground to witness that, and I think it was just very magical. And also, I guess no one can take away those relationships and shared lived experience that are established now, and will go a long way to strengthening our social cohesion. The other bit was around how small businesses were so generous, despite being also impacted and themselves struggling. Many donated materials and funds to support the community's effort. And that was just wonderful to witness. Community members, faith leaders, business owners, community elders, all coming together, joining the VMC and the Department of Health's roundtable to clarify information and take that back to their communities. Those were also very critical. And also the incredible amount of community-led response, often unheard, and those supported those most in need. I know several individuals who even worked full-time jobs and worked till early in the mornings, translating, creating contents so that they can be pumped out to their communities first thing in the morning. And we know that misinformation is as dangerous as the virus itself. Also, the other point that I want to mention is around how many in the communities were raising funds or collecting donation to share those IT devices that are so critical to keeping our communities connected. And also so that our young people, those who are in school, can continue their learning journey virtually. And apart from all of that, over the weekend, I had the opportunity to attend a community function, and we had the achievement awards of the VCE awards, and the marks that those students achieved were just incredible, and so much credit to the teachers, but also to the parents and those young people, their resilience and keep in keeping focus on their goal. And all, of course, the selfless community members who volunteered hours and hours to making their to supporting their community to be safe, but also to be supported in receiving those much needed material support, and that generosity spirit is just wonderful. We also saw that due to this pandemic, we have been pushed into adapting to technology, and it has really pushed our communities to being so innovative, so that we can continue to be connected, be it for faith services, be it for cultural events. The adaptation was just incredible. We also saw an increased engagement for those in regional Victoria, and I, for one, can say that I was able to participate in many regional forums and without having to travel. And I think that is the benefit of technology and how it has transformed our lives. I also want to acknowledge the bravery of our community leaders through a very, very difficult time. Psychological bravery is one thing, and we definitely saw that. But to physically go out amongst the unknown, the highly contagious virus, and especially in the early days when it was all a mystery still about this virus, and to see those community volunteers helping with not only the virtual ones, but the real door knocking campaigns, making sure that the communities were getting tested, and also in supporting the vaccination drive was incredible. The pandemic has really led to us as a broader community to appreciate our healthcare workers even more, and their sacrifice in keeping our communities safe. Also, one thing I want to mention is that the Victorian government adapted quickly to working with communities, even more amplified. It was even more amplified, and this was fantastic. Working alongside government, the community was so willing to work with the government and vice versa in ensuring that all the communities, the hard to reach or hardly reached communities, the vulnerable communities' needs and issues were addressed. Also, witnessing and seeing, senior staff, government department staff attending and working alongside those community leaders is incredible. I also want to acknowledge the establishment of the COVID task force, which was, I think, very critical in gathering information, but also in responding to critical times and also ensuring the coordination of the government fundings to the communities most in need. And I should mention that there has been an increased awareness within government department and agencies of the importance of that genuine communication and engagement with our multicultural communities. While there are issues, the other point I want to mention is that in the past, we've seen translated materials in 10 to 15 or 20 at most, but during the pandemic, we saw that increase of languages used, over 60 languages to cover the pandemic and the COVID safe messaging. And this was very critical, and it provided a real tangible outcome. But also to complement that, the move to use audio and video, and also utilizing the social medias, and also working alongside those trusted community leaders to get this message out, and working alongside those multicultural radios and press was so critical. And those are, I think, the things that come to the forefront. Of course, the pandemic also highlighted to us the long-standing issues that our communities are facing. Our multicultural communities face disproportionate challenges as a result of COVID, but also it highlighted some of the pre-existing issues that needed attention, and I think COVID brought them to the forefront and amplified their impacts. And so I think in issues surrounding like housing security, casualization of job, health literacy, navigating government services for both individual and also for small businesses, mental health services, family violence, the need for, I guess, diversifying workforce, the need to co-design with communities, as all mentioned, and also how critical government funding is that really helps to amplify the work of our communities. And of course, the issue around racism and how devastating it is to social cohesion. And we saw that increased number of racism due to this pandemic. Because of the pandemic, there were some great learnings, and it also allowed us as individuals and governments and also service providers and community groups to work in collaboration and in partnership. And I think for one, we are not working in silo anymore. We are part of a bigger movement, and that is fantastic. We also understood the true value of working from home, and also how quickly, the other point I wanted to mention was how quickly funding were being distributed to the most needed communities. And I guess, how much red tape is really necessary to maintain due diligence. And the government was able to adapt to it, willing to listen to the community leaders and address their needs was, I think, some of the great learnings. Also mobilizing different groups in emergency situation. I guess online briefing is an example of how effective it is to get information out to the communities. And we've done that on a number of meetings, sometimes on a daily basis. But I want to thank all the community leaders and representatives and the organizations that joined us on this journey, because getting those critical information out to the community was so critical. There's a lot of work that will be done to move forward, and the VMC will continue to support our communities and the government to put into practice the learnings into practice, making sure that we can come out of this pandemic as challenging as it is into a more united but also more cohesive and stronger as a community. I just thought I'll just very briefly mention that in terms of the structural changes, I think for one, using trusted community voice and having that increased language translated materials was so critical. But also we saw that both government and communities willing to work together. And I think these things should be maintained beyond this pandemic. I guess the role that the VMC played was very active and practical, but we were able to do this because the community was, so willing to work with us, and vice versa from the government as well. And so for us, from those door knocking campaigns to those translated materials to featuring on numerous videos and running info session, we are very fortunate that we could play a small role in assisting our communities as we went through such a terrible time. I guess.
Sorry,
thank you. I'll just finish off that I sincerely hope that this recommendation and these learnings, the establishment of the anti-racism task force, and all of this will really benefit us going forward. And I hope that we will safeguard those things and put into place some of these learnings so that our communities can continue to thrive in Australia. Thank you, Anthea.
Thank you, Brave, very much. The VMC has played such an important role, but also I think it's important that where you highlighted that the state government has learned and improved some of its systems and progressed some of those long-standing issues. So I agree. Let's hope that we all continue to learn. And now for our final speaker is Licia Heath, the CEO of Women for Election Australia, with leaders currently travelling the country hoping that we will support their various agendas. It's absolutely vital that we consider the implications of our learnings regarding the pandemic response and what influence they should have on public policy at all levels, and what questions should we be asking those that are running for office. Licia, welcome.
Thank you, Anthea, and thank you to my fellow panelists and to everyone that's joined us today. I have 10 minutes to address something that I could easily do over 100 slides, but I refuse to do that because there's some high points that I really, I guess, want to highlight through this session. Let me start. I am coming to you from the lands of the Gadigal and Bidjigal people of the Eora Nation, and I would like to pay my respects to leaders past, present, and also to future leaders emerging, and acknowledge that sovereignty of this land was never ceded. And it is my belief that until we reach a treaty with First Nations people, then our ability to move forward together in harmony is jeopardised. The role of Women for Election is to inspire and equip more women of all backgrounds and lived experience across our country to consider a role in political office. That role could be with the local council, and we've already heard about a number of councils mentioned on this today. It could be at the state level or the federal level or at the Senate. Wonderful thing about Australia, we have multiple tiers of government and always an election on somewhere at some time. So there are multiple opportunities to get involved in public office. And Trish, something you said at the outset in terms of the survey that you conducted and surveying those members, those individuals that have a deep understanding of their communities, are exactly the people that we want to inspire and equip into public office. Because I think it is too evident that the lack of that deep understanding of communities resulted in unintended consequences at the back of the COVID recession due to policy responses. So I'm going to talk about those in terms of how that affected women. And then in particular, I want to focus on the solutions to that. So I'm going to share my screen now. And maybe my fellow panelists can give me a thumbs up if they can see that. Terrific. Okay, so in terms of, there's lots of reports, and almost certainly you have been across a lot of the details, came out of Grattan Institute, number of books written per capita, wrote a great report as well. So did the Sydney Institute in relation to effects on women out of the pandemic. I know that I felt those effects, but I am also very aware that I come from a privileged position, and as Boy and have discussed in terms of how, and you as well, Trish, depending on your starting place, then the effects were felt differently. This first chart talks about why this ended up being discussed as a pink recession, the COVID recession. And this is from the Grattan Institute's paper from last year, and it shows the change in employment for men and women in the 1980s recession, in the 1990s recession, through the GFC, and then in the COVID recession. And then, and it is, you know, there was a greater number of women in the workforce in the COVID recession. There was a greater number of jobs in the service industry, greater number of casual workers, dominated by women, and also labour had changed considerably in terms of construction and manufacturing industries. So it was women who suffered really what I would call a triple whammy, in terms of women suffered the greater number of job losses or diminished work hours. They took on the greater proportion of unpaid work that came with homeschooling and everything that was required for us to do through lockdowns. And then the industries that women found themselves in were not getting the government stimulus either. That is the triple whammy. And this is emphasising that last point. So down the left-hand side, you have the different industries, and these are listed in terms of short-term casuals. So a lot of short-term casual jobs in hospitality and retail, for example. And women make up 50% of the hospitality workforce and make up 67% of the retail workforce. And it was hospitality, retail, and art and the arts industry that were the hardest hit of job losses and in terms of lack of stimulus. My final economic, this is my background. I'm head of Women for Election now, but this is my final chart on this, I promise. But this is going across the stimulus that was received, combined federal and state governments. The size of the circle is the size of the industry, and the darker the circle, the more women are in that industry. So you can see on the y-axis which industries received the most stimulus through the COVID recession. By far and away, it was the construction industry, and there has been a lot that's been discussed. And by far and away, those that received the less stimulus were those where women had the highest proportion, made up the highest proportion of workforce. Now, on to our current state of play in terms of women in political roles in Australia, and why we exist and why it's so important that these numbers are increased. So across our state, federal and local government levels, women make up between 35 and 37% of those public office positions. Now, that is very fragmented. Like, for example, that 37% in federal parliament, the federal Senate has gender parity right now. The House of Representatives is sitting more like 29% women. So, and then in local government, that changes massively as well. Victoria is the strongest with about 45% of councillors being women, but there are some states that are still sitting in the, well, New South Wales, as of early December, was sitting at 29%. And I'm very happy to say that we played a large role in lifting that number to 39% post the 4th of December elections. But that took concerted effort, running workshops through rural and regional New South Wales and partnering with our sister organisation, Politics in Colour, where we went out across the state, fizzing up the women of those communities, letting them know what they could achieve through being elected in their communities. Now, let's keep in mind, these women were already community leaders, doing extraordinary work for their community, always pro bono, always. And again, what Boy and Om were talking about before, you know, whether that be helping with relief through the COVID pandemic, or bushfire relief, or drought relief, or they're running the local school P&C, or the local business chamber, or they have a small business. It goes on and on and on, but doing amazing community work, but always pro bono and in an unelected position, where it could be in an elected position, getting greater outcomes for their community and getting paid as a consequence as well. So in the New South Wales local government elections, we had the highest number of female candidates ever, 42%, and the highest number of First Nations candidates ever at 3.9%. And you know, the only way is up from there as well. That's talking purely about gender. Now I want to focus on diversity and just focus on the 46th Parliament there. So there's 227 positions in our federal parliament when you look at the Senate and the House of Representatives. Of those 227, 81 are women, 22 of them are born overseas, and only 9 with a non-European parent. That cultural diversity in our federal parliament is extraordinarily stark when you compare us to, say, the UK or Canada or US. And one of the very limiting factors based on that is in our constitution, in terms of you needing to give up overseas domicile to citizenship in order to run for our parliament. We might come back to that in some Q&A. The World Economic Forum put out a gender gap report every year, and it ranks all countries against each other. And this is the report card for Australia. And I'm very sad to say that, you know, we've been falling every year since this report has been produced in terms of the empowerment of women and girls in our country. And it's done on a number of measures. So we were 15th when this was first done in 2006. We were 44th in 2000, and then last year we fell to 50th. If you look at the spiderweb diagram on the side there in terms of our education, economy, health, and political empowerment, Australia should have extraordinary pride in terms of our educational attainment for women in this country is #1 in the world and has maintained. The number of women with tertiary education is #1. Our political empowerment has been falling since this report has been done. So a direct correlation done by the World Economic Forum between the number of women in parliamentary positions, and in this case, we're talking federal, and I mentioned there's also state and local, direct correlation between the number of women in your federal parliament and the outcomes for policy for women in that country. And this is very stark versus our equivalent OECD nations. Now, we are a non-partisan organisation. We have helped women get elected for all parties, all major parties, minor parties, and as independents as well. It is not our role to tell, you run according to your values. Our role is to give you, to make what is currently a very opaque process, which is how you would run, more transparent, with the notion that the more transparent something is, the more likely that people, and I would argue particularly women, would be to step into having that as a role. Now, I know that you can't actually answer me for this, but I thought I would give an example of how possibly some of the policy outcomes we had in the COVID recession came to be. Now, you can't answer me, but I was going to do a Q&A. What group of individuals does this make up? Or did it make up? It was in 2020. I'm going to answer my own question. This made up the Expenditure Review Committee of our federal parliament. So that is the committee that determines where the budget will be spent. So that was our 2020 Expenditure Review Committee. Obviously, extreme lack of gender and cultural diversity. In 2021, our Expenditure Review Committee looks like this. So more individuals, now one woman, but obviously cultural diversity is extremely lacking as well. So let's hope 2022 will look even better in that respect. But I always challenge everybody to say it can only improve if there is a pipeline of individuals in there ready to take over that role.
Licia,
yeah.
I think you're making some really important points. I do want to make sure we leave enough time for questions.
Oh, yes, of course. So, I was watching my time. Oh,
but in actual fact, I think you've really hit on such a lot of really important points that in order to generate the learnings and expand the learnings that we've got here, that we're all sharing at the moment, we actually need more people in these particular political roles to be sharing this information and making sure that actions are taken by people who actually know what the experiences are.
Absolutely. So, I will stop my screen there and let's go to Q&A, Anthea.
Well, I think one of the questions we've also had has been about sharing slides, and yours in particular, Licia. I think people are very keen actually to see all of them, but you had some amazing statistics in there, so we will reassure people that the slides will be shared.
Very happy to share them. Yeah.
Very important points. I do want to thank all of you today. Your views and perspectives have highlighted lots of experiences, but I won't go on. I will just get straight into the questions. There has been a number of questions, and some that were shared before the session today. Reflections on the reduction in silos and red tape. One of the questions was how much red tape is necessary to maintain due diligence, and I think, Wei, one of the points that you made was that we've seen a reduction in the amount of, an awareness that we can reduce red tape and still actually make stuff happen. Do you have a view about due diligence? And I'm asking for quick, snappy answers.
Thanks, Anthea. I think in the past we've had a numerous, level of assessments on giving up grants, and I think what really complemented the progress to the system to progress faster was also hearing firsthand from the community the needs, and those community leaders' voice was so critical. But as mentioned, the Coal Task Force was instrumental in identifying and closing those gaps, and those really fast-tracked the process of those funds reaching to those that really needed it, or those organizations that need to do those important work. And so I'll leave it there.
Thank you very much, Bray. That's terrific. Another question was, can governments ever go back to treating communities as passive recipients of their services after these experiences? And how can we keep that lesson of strong community engagement front and centre? Did you have some thoughts about that?
You're on mute.
Okay, sorry. To be precise, I think for service providers, governments, and anyone working in the community, I think community engagement should perhaps be the rule, not an exception. So far, I think it's been treated as add-on and when necessary. So secondly, what we need to do is move from doing for the community to doing with the community. I think that's really, really important. So far, I think it's doing for the community. put resources and do that, but it has to be moving from that doing for the community to doing with the community. And thirdly, we also need to move from transactional service delivery. While those are important, but what we need to do is take a more collaborative approach, more relational approach, and deliver services based on what is actually, required in the community. And I think your research finds something really interesting was 86% of the people are happy to help their neighbors. Isn't that fantastic? I think we can demonstrate that we can help each other, take care of each other. So I think that's already there. So government needs to fill in the gaps, not try to do things for the community. So it's about implementing what's already there, nurturing what's already there in the community. So
absolutely great point. There were then a couple of statements. One is that there is a lot of mistrust in politicians and the political process, which often puts women off. The level of sexual harassment and misogyny that have emerged do not help to encourage women to seek a career as politicians. But I would only encourage people to get in there and be politicians, because that will change the system. And the other, of course, is a statement that it would be useful to have feedback on what funding has been provided through this process, through the pandemic, and how it is being used. Now, one of the other previous is quite a big challenge. How do we build or rebuild cohesion between the vaccinated and the unvaccinated? Anybody want to take a leap into that? Trish, any thoughts? How do we build that bridge between the vaccinated and the unvaccinated?
Probably it's a little bit outside of the scope of the work that we did, but I mean, I would imagine that the tools are pretty much the same in terms of building cohesion between any groups in society, and certainly listening, conversation, openness would be part of that process.
Great, thanks Trish. Now, I know a couple of people, Bray in particular has mentioned that COVID has enabled racism and vilification to raise its ugly head. What can the common person do to avert this insidious danger? Bray or Om, either of you?
I'll start off and maybe Om can add to it. I think most important is that we need to report it and make sure that those are captured, but also through the reporting, what happens is it allows decision makers and policy makers to identify the needs to respond to this critical and important issue. So to the community members, if you're facing racism, please report it so that it all adds up, and it is very, very important. Over to you, Om.
You're on mute, Om.
Mute myself, but anyway, I'll go by your report, which shows that the cases of, like, I think racial vilification or racism hasn't really gone up. I think if I go by your report, which is fantastic. So I would love to believe that that's the case. And secondly, I think we live in a country which is, I just think that this is the best country in the world. So we just need to keep enhancing. And those numbers give me a lot of comfort saying, okay, if we are willing to help, if 86% of the people are willing to help their neighbors, and that neighbor is not your own kind, definitely, because we live in such a multicultural community, we are willing to help each other. So I think I will really believe that, we are there as one community. I think the way we define our identity really makes us as leaders, because if we define ourselves by our religion, culture, background, then we tend to protect that identity by, doing anything possible. But then if you identify as a human being, then your identity protects all the human beings in the world. So during crisis, it's really important what identity you take. And if you take an identity of a human being, then you're able to work with every human being and, contribute to social cohesion and harmony in the country.
Absolutely. Lisa, I'd like to thank you for the amount of feedback that you're providing in the chat section as well. Even though I haven't necessarily given you questions, you've been responding to people. So that's really terrific. Now it is 1:30 and I do want to make sure that we finish on time. This has been a terrific discussion. I think from the chat, it's clear that people have got a great deal out of everything that's been shared. And we are eternally grateful to all of the speakers for having participated in this Scanlon Foundation Research Institute webinar. So thank you all very, very much. I do hope that you, your family and your friends all stay very well and have a good day going forward. So thank you all very much. Bye.
Thank you all for having us, and thank you for attending. Thank you.
Thank you.